Recovering from COVID and other viruses. I'm Dr. Z, I'm known as the brain guy. So COVID-19 is something that's hit us over the past nearly 2 years. There's a lot of individuals that get the virus and don't notice any symptoms. There's another group that gets it, they get symptoms, but after a week, 2 weeks, or 3 weeks, they feel completely back to normal. But there's another group, and this group is growing. This is the group that gets the virus, and it may or may not be that bad. For some it is, but for some it's not. But the problem is, instead of it going away after 2 to 3 weeks, the symptoms carry with them for months to go. So there was research done that looked at what were the symptoms people had at 7 months or longer after developing COVID. Here were some of the symptoms you could have: brain fog, fatigue, headaches, muscle aches and pain, joint pain, altered sensory issues such as numbness, tingling, shortness of breath, rapid heart rate, and many others, even including insomnia and dysautonomia. So there's a lot of symptoms that can persist from this virus. And the thing is, the virus, it's not going away. It's going to be something that will probably become like a yearly flu, where it's going to be there. So why are people going into long COVID? But also, even for acute COVID, what really needs to be done to help recover? Depending on which one you're in, it actually needs to be approached differently. For example, acute COVID is about getting your immune system, one, to deal with COVID, but two, to not have so much inflammation to tip you into this inflammatory storm that they call a cytokine storm. Long COVID's different because your body, for the most part, has essentially beaten the virus, but it hasn't dealt with the aftermath. It's like having a storm that comes through, it does damage, but now you have to clean up and then repair and rebuild. Now, the parts that need to really be dealt with long COVID is inflammation and immune changes, but also energy-based changes with how these components of your cells called mitochondria produce and use energy. Only when that's evaluated, appropriately treated, do you recover from long COVID. But once again, treating the initial phase of COVID appropriately goes a long way in helping to reduce the risk of long COVID. And also just having your health before you get sick is really important as well, because the less issues you have walking in, the better your chance of walking out. Hope you found this information useful. If you'd like my help, let me know.